Hello, everyone. My name is Lizzie, and I am the intern at the Endright Centers for this spring semester. I am a senior at Indiana University studying community health, and I will be attending graduate school to become a physician assistant in May. And so I have some experience as a nursing assistant in a hospital in Indianapolis. And so I'm going to use some of that knowledge from that experience as well as the classes that I've taken at Indiana University to talk to you about heart health today. So I'm going to share my screen here. So I'm going to talk about heart health. It's February, and that means it's Heart Awareness Month. So happy Heart Awareness Month, everyone. So first, I'm going to talk to you about cardiovascular disease, what that all entails. I know everyone has probably heard about it to some degree at this point. And then I'm going to go into some of the risk factors for different cardiovascular diseases and how to reduce these risks. So the first thing, cardiovascular disease, it's the result of the buildup of plaque in your arteries, which is known as atherosclerosis. And over time, and as we age, there is a higher risk of this plaque buildup. And so this contributes to a narrowing of the arteries that surround your heart, and this slows your blood flow. And so I'm going to talk to you about 4 common cardiovascular diseases. The first one being coronary heart disease. And coronary heart disease is the buildup of fat deposits in the arteries that surround your heart, or your coronary arteries. And this constricts blood flow to your heart. And now congestive heart failure is actually caused by coronary heart disease. And this is when fluid builds up in your heart chambers due to, again, a lack of blood flow. And one of the main causes of this is chronic high blood pressure. And according to the American Heart Association, they've estimated that about 1 in every 3 deaths in the United States are as a result of heart disease or stroke. And that makes it the #1 leading cause of death in the United States. So I'm going to talk to you about 2 other types of cardiovascular diseases. There's heart attack and stroke, which I'm sure we've all heard about. Heart attack is when the blood flow to part of your heart or one of the heart chambers is blocked by a blood clot. Then we have stroke, which is very different than a heart attack. And that is when a blood vessel that feeds blood to your brain actually gets blocked. And that's usually also caused by a blood clot. And so what causes these blood clots? The first thing is high blood pressure. So chronic high blood pressure can contribute to blood clots because it constricts blood flow to certain parts of the body, such as the heart. And so the blood actually has to collect somewhere. It also causes extra strain and damage to the arteries surrounding your heart, the coronary arteries. The second thing that can cause blood clots is this plaque buildup that we've been talking about in your arteries, and that's caused by cholesterol. And this leads to atherosclerotic ruptures, which is the rupture of the plaque that surrounds the walls of your arteries. And this can lead to the congregation of blood platelets and starts the process of forming these blood clots. And so here's a look at some of the risk factors. I just made a list of some that can contribute to cardiovascular diseases. And I'm going to talk to you about how we can reduce some of these risks. So the first thing, I'm sure we've all been told to maintain a healthy diet. So the first way, of course, is to reduce your risk by maintaining this healthy diet. And that means maintaining low sodium levels to reduce your salt intake, low fat levels to reduce your cholesterol levels, as well as low sugar and moderate carbohydrates. And actually limiting your sugar here is very important for reducing your risk for diseases such as diabetes, which can be another risk factor for cardiovascular diseases. And then, of course, eating high levels of fat can increase your cholesterol levels. The next thing that they say to reduce your risk of cardiovascular disease is exercise. So I'm sure we've all been told to exercise regularly. We've been talking about this for a long time now. Um, Maintaining a healthy routine will improve your HDL levels, which is the good cholesterol, and flush out the bad cholesterol, which is your LDL levels. It can also improve your blood pressure over time because your heart is getting stronger, which makes sense. And so the stronger it is, the easier time it will have pumping your blood throughout your body. And this will eventually decrease your blood pressure reading over time. And so research actually suggests that people should exercise for about 2.5 hours per week, um, especially for ages 50 and older. They say about 2.5 hours per week, which is about 30 minutes for 5 days a week. The next thing is sleep. So we all know sleep is important. And in this case, sleep is important because when your body's at rest, your blood pressure will decrease. And this is known as nocturnal dipping. It's very important to maintain your health. And when you are awake longer, your blood pressure will tend to be increased for a longer amount of time throughout the day. And so people aged 50 and older are advised to maintain the same amount of sleep as young adults, actually, which is about 7 to 9 hours per night. The next thing is managing your stress, which I'm sure can be difficult at times. And stress can affect a lot of different things. Research actually shows that the cortisol hormone that is released when you're stressed can actually cause multiple things, including increased blood sugar, increased blood pressure, and cholesterol levels. And then finally, these last two are what I would like to focus on the most in this particular presentation. The first is checking your vital signs, and I'll talk about what those vital signs are and why that's important for reducing your risk for cardiovascular diseases. And the second is having a plan in place if something were to occur, because we can't always control everything. We can do everything right, and still things can happen. And so I'll talk about that a little bit later too. So the first is checking your vital signs. So according to the American Heart Association, around 60% of Americans actually do not know their blood pressure or cholesterol levels, including myself. Many healthcare providers actually call blood pressure the silent killer. And that's because many people do not check their levels often enough to even know what they are. And so according to the American Heart Association, lowering your blood pressure could actually reduce your risk of cardiovascular disease by about 50%, which is huge. And so this is because high blood pressure actually places a strain on the coronary arteries, which are the arteries that serve the heart, that surround your heart, and causes actual damage that results in this plaque buildup that I've been talking about. And so for this reason, blood pressure should not be taken lightly. The second thing that you could be checking is your cholesterol levels. And so obviously you can't be doing this at home. You need to go see your healthcare provider for this. But cholesterol levels are important for reducing your risk for cardiovascular disease as well, because it reduces plaque buildup in your arteries. And so one important thing is to limit your dietary cholesterol. Your body already produces enough cholesterol that it needs. And so in order to lower your overall blood cholesterol levels, you should focus on limiting your dietary cholesterol. So you may see this in meat, poultry, eggs, and dairy, for example. And this can prevent this high cholesterol level. You can also work on exercising more often. This can often prevent weight gain, and that in turn will decrease your cholesterol levels over time. So let's take a look at blood pressure. What does that entail? What are these numbers that we're looking at here? So I'm sure many of you have seen your blood pressure before. There's a top number and a bottom number. The top number is systolic, the bottom number is known as diastolic. And so what do these terms mean? So actually both of them have to do with the pressure of blood on the walls of your arteries. And so systolic is when it measures the pressure of blood on your arterial walls when your heart beats. And diastolic is actually the opposite. It measures the pressure of blood on your arterial walls and between these heartbeats. And so I actually found a very useful video about taking blood pressure from home. I thought it would be important to understand how to properly get these readings and understand your numbers and be able to get some accurate results. So let's take a look at that. And this video is from the university, from Michigan University Medical School.
Here's how to take your blood pressure at home. Before you begin, 2 hours before, no alcohol or eating. 30 minutes before, no tobacco, caffeine, or exercise. First, sit down and relax in a chair that has a back. Uncross your legs, put your feet flat on the floor, and keep your back straight. Wait 5 minutes before beginning and try not to talk during this time. Take your log sheet and pen out so that you are ready to record your measurements. Grab your blood pressure monitor, set up the cuff per its instructions, and make sure your arm is out straight and supported on a flat surface. Begin taking your blood pressure and make sure there are no distractions or talking during this time. After the reading is complete, wait 1 minute, then measure a second. If your blood pressure is high, repeat the reading a third time and record the lowest of the two. Finally, record your measurements in your blood pressure log. Be sure to contact your physician if you have any questions or concerns regarding your blood pressure readings.
So I thought that was a great video that outlined some of the important parts of taking your blood pressure from home. So let's get back to this slide here. So I just outlined a few important parts from this video. The first being limiting your caffeine and exercise about 30 minutes beforehand. That's in order to get the most accurate reading, because a lot of times those two can increase your reading and you don't want to have a cause for concern. The second is to rest in a chair with your legs uncrossed for about 3 to 5 minutes beforehand. That's really important as well to make sure your blood is flowing properly and you're going to get that accurate reading again. The next thing is to take your blood pressure at the same time every day. Now, you may want to take it multiple times a week, and that's completely fine, but try to stay consistent with what time of day that you take this. And that can be in the morning or in the evening. It doesn't have to be a specific time. And the last thing is to take several readings a few minutes apart. So the video said to take 2 readings a few minutes apart, and if your measurement was a little high, take a third one, and then take the reading from the lowest measurement. So now let's take a look at the numbers. What do these numbers mean? So a normal level would be about 120 over 80, and 120 being systolic and 80 being diastolic. And then when you get to the elevated stage, your systolic will be about 121 to 129, while your diastolic will be about under 80. Now, getting into the hypertension stage, that's when you're at the most risk for cardiovascular disease. And that's when your systolic will be about over 130 and your diastolic will be over 80. So it's important to understand what blood pressure is. So let's review. This reading gives a sense of how hard your heart is pumping and how hard it's working to pump blood throughout your body. And so if you're getting readings in this elevated or hypertension stage, you should seek advice from your healthcare provider on how to proceed. It's not always a cause for concern. There are many different factors that may cause these elevated levels, including certain medications that you may be prescribed, etc. And so this is why it's important to ask your provider about your specific situation. Now, let's talk about cholesterol levels next. So having high cholesterol levels is actually another risk for cardiovascular disease. And there's two different types. I'm sure that some of you have heard about these. The first is high density lipoprotein, which is HDL. And then there's low density lipoprotein, which is LDL. And so HDL is actually the cholesterol that you want to maintain because it carries cholesterol in your body to the liver, where it can be removed from the bloodstream before it even has the chance to build up in your arteries, like I've said. And now the LDL is the type of cholesterol that you want to avoid because it actually carries cholesterol directly to your arteries, where it will build up over time as we age. So it's important to get your blood cholesterol levels checked every time you visit your healthcare provider for an annual checkup. In order to reduce your risk for cardiovascular disease, you want to maintain a total blood cholesterol level of about under 200 milligrams per deciliter. And so your total blood cholesterol level actually includes both HDL and LDL. And it's important to ask if your blood work, when you go to your healthcare provider, if your blood work actually includes this blood cholesterol level, and what your individual levels will mean for your own health. And finally, I think that it's really important to take a look at creating a safety plan, not only knowing the facts for your own health, but for the health of people that you surround yourself with. So the first thing I think is important is knowing the warning signs. And we're going to take a look at the warning signs for a heart attack and for a stroke. Now, for a heart attack, you may experience or notice in someone else tightness or pain in the chest or arm, and that may spread to the neck or jaw or different parts of the body. You may also notice shortness of breath, cold sweats, or sudden dizziness. Now, in a stroke, it's a little bit different. You'll notice sudden weakness or numbness in your face, leg, or arm, especially one side of the body, which is more of a telltale sign for a stroke. You may also notice sudden confusion and trouble with different bodily functions, such as speaking, walking, or seeing. So again, it's really important to recognize these warning signs and act quickly. And so that's where I'm going to get into creating a plan and then communicating it with your family or the people that you surround yourself with. So I made a list of some of the most important things to do in the case that someone around you may be experiencing a heart attack or a stroke. So the first thing is to call 911, of course. The second is to take notes, if possible, when the symptoms began. This may be helpful later on for the providers to understand how long it's been since the symptoms began. The second is actually a tip that many people do not know about. It's actually putting aspirin under the person's tongue. And that's because aspirin can actually slow blood clots by dissolving them altogether. And this can slow the progression and symptoms of heart attack and stroke. And this could actually potentially save a person's life. And so unless this person is directed by a provider to not take aspirin, maybe they're allergic, it's important to have aspirin on hand and place a few under their tongue because that's able to absorb much quickly. And then another important thing is to not allow the person to sleep or even refuse emergency care. If they're experiencing these types of symptoms, it's a sign that something serious is happening. And so you should stay with this person. And if you are ever to the point where this person goes unconscious, it's important to begin CPR. And then you wait until emergency services arrive. And so it's important to have this list on hand, again, not only for your own health, but for people that you surround yourself with. It's important for you to know what to do in case you need to help someone else. And so these are just some of the information that I've gathered from my experience in the hospital, as well as my classes at Indiana University. So if you have any questions, feel free to reach out to me. I'll be at the Invite Center until the beginning of May. And so you can reach out via phone or email. And thank you for listening, and have a great day.